You are now?
Thank you very much. All right then. Welcome to the entire crowd of people, all two of you, and to the Community-Oriented Policing Committee for Santee. It is Monday, October 13th, 2025 at 2:01. So we do not have a quorum today so far, and that could be part of the holiday or perceived holiday by some. And so we'll go ahead and call roll anyways. We just won't be voting on anything without a quorum. Probably should speak into the microphone. Thank you very much.
Mayor Minto.
I'm here.
City Manager Gary Halbert.
Here.
Sheriff's Department Captain Hernandez.
Here.
Linda Roach.
Here.
Steve Stellman.
Here.
And Danette McLean.
Here.
We do need 3 more members for a quorum, Mayor.
Yeah, all right. Well, maybe we can get done before they get here. I mean, maybe we will be, never mind. All right, you know, I watch these COMPOC meetings back sometimes on channel 117 to see how we're all doing and everything. And one thing I can't stand is the guy that runs this meeting is always making silly comments and things like that. So it just drives me crazy. So, all right then. Okay, let's see. First up was roll call. That's done. And then we won't do the item number 2, which is the approval of the July 14 and September 8th, which means we're going to have to try a little bit harder to get a quorum here for the next meeting so we can approve all that stuff.
We'll do our best. It's also a day before a holiday.
Yeah. I'm here. They should be here. Linda's here. They should be here. Steve's here. They should be here.
Absolutely. I'm here.
I'd say your name, but you're honorary.
Yeah.
You can't vote anyways.
Nothing. Just here for my stunning good looks.
Affirmative. And Carl will probably be here, won't you, Carl? More than likely. Okay, then. All right, so let's skip over that one then. I'm really just trying to stretch this out a little bit, see if anybody else comes in. I learned that in, I think I took some stage production in school. They said, stretch it out. That's where I learned that. Yes. So, all right then. Well, let's at least go on to item number 3 and see if we can stretch out the updates on neighborhood watch and crime prevention. El Capitan.
Yes, sir. Good afternoon. So we currently have a vacancy in crime prevention. Christina has transferred over to our Rancho San Diego station. So we're awaiting a qualified candidate, and we'll let you guys know when we find somebody. In the meantime, our deputies do what they can to go out there, participate in events. I know that we participated in the open house for the fire department, and on a daily basis, they encounter people throughout the community, at the parks, at the schools, even as they grab a bite to eat, and they, they talk about crime prevention and just answer whatever questions people might have, take pictures with the kids and stuff like that.
Yeah, my guess is they probably encounter them when they go through red lights, stop signs.
That too.
Go too fast.
Those aren't as friendly encounters, but they're still encounters.
I'm sure, though, Carl probably appreciates the fact that we do stop and going through red lights. Am I correct?
I would appreciate it if I ever saw it.
All right, then.
What's that,
Anything?
sir? No, that's it, sir. Thank you.
What's the problem over there? You scare away the crime prevention people or what?
I don't know. Maybe we've had 2 so far since I've been here, so we're about to go on our 3rd.
I heard you weren't that tough to work with. Proof is not in the pudding.
Yeah, maybe. Thanks, sir.
Okay. Let's get away with that for a minute. All right, then. Let's do, let's see, number 4, 211 San Diego presentation. And I'm sorry, but I don't have your name listed here. So when you come up, please give that to us.
Yes, thank you. My name is Jessica Peter. So I think that, you've got it all set. Thank you, Mayor Minto, and distinguished members of the committee. It is a pleasure to be here today representing 211 San Diego. which is a local nonprofit organization that serves as the San Diego region's 211 provider. And I'm happy to share all the information I can today with you and answer any questions along the way or at the end, however you choose. So my name is Jessica Peter, and I am the Vice President of External Affairs at 211 San Diego, and I've been with the organization for 16 years. So whatever I share today, I'm happy to go into the depths of how and why things have come to be. And I will start by explaining our why. So why does 211 exist? You might not yet know what it is. I haven't gotten there. But why? So if you think about when somebody needs help and they decide they're going to actually seek help, they begin the process by going to a friend or their faith-based community or to somebody that they trust, and then they're referred usually to a place that that person knows or that their local organization knows. And they start the process of trying to find help for whatever it is that they need. But it's not always the right place. And so they might not be eligible for whatever service that their faith-based community has pointed them to, or that service that they're reaching out to for help, for food or something like that. Maybe they're not eligible for that, but that service provider wants to help them. And they say, okay, I'm going to try to send you over here. We know about these organizations. It becomes a maze of frustration and confusion, and it can be overwhelming to people when they have decided that they do want to reach out for help. And they face barrier after barrier. And we see this, especially for this committee, in different populations like those experiencing reentering community in different places. So those barriers are faced by a lot of different populations. And so in the year 2000, the Federal Communications Commission designated the 211 dialing code, much like they've designated 911 and 988. They designated 211 to be the number to call for community information and referral services. And that was really to address that whole maze of confusion that people experienced in making all these different phone calls to different places and showing up at doors and it not always being the right door. So across the United States, there are 211 providers that can answer a phone call through a call center and then connect those people to community and health services. So that's kind of the background of why a 211 exists. And then to think about what are those community and health services. There's a long gamut of different kinds of services, but this is just meant to give you an example, a couple different examples. But people might need food today or in a couple weeks. People may need help paying their utility bills. Sometimes people are looking for ways to access health coverage, or if they have a medical appointment but they can't get there, they may need help getting there. Resolving conflicts with your tenant or with your landlord, or you're raising a child and they have behavior issues or some other kind of developmental issue and you don't know what to do and they're not in the school system yet. There are resources out there, and we have that database. 211 organizations have that database of their local community resources, and that's how we're able to help address these different needs that people may have. I also want to point out there's a couple others on there just to give you an example of maybe a caregiver needs a break, or people need to find childcare so they can go to work, things like that. So 211s I mentioned are across the United States and throughout California. They're not in every county, so there are some counties in California that are not covered. There are some counties that are only covered for special disaster responses, which I will explain more. But we are very fortunate because in San Diego County, we are the local 211 provider, and you can call 211 24 hours a day, any day. We're never closed. So we are the nonprofit organization serving San Diego County. We also serve Imperial County. And so our mission is to seamlessly connect people to those community and health services, and to also transform how people are accessing that help. And that is a whole nother layer. So we're not only making the connections, but we're also working with our partners in the community to try to make changes to how the system works. Our service impact, our kind of primary areas of service that we provide are information and referrals, like I mentioned, to the community and health services. And we do that in blue skies and gray skies. And I say that in that day-to-day is the blue skies, and gray skies is any kind of disaster or public health crisis. And then we also provide care coordination services, which is kind of hand-holding people over time, not just giving them a place to call or a referral to a place, but we're also taking care of them over time. We also can provide enrollment assistance into different programs and schedule appointments for people for different programs. And then we provide data reports and analyses. So if the city of Santee wants a data report, we'd be very happy to provide that as just a community partner of yours. And then we also have a community calendar, which I wanted to highlight today specifically for this committee, because I think that would be very useful. And so just so you get a sense of our organization, we are about 300 people. It varies any day to day. And then we have different types of funding. So I will say that we are a dialing code that's set aside by the Federal Communications Commission, but we are the dialing code that doesn't come with any type of federal or state funding. So 211 does not receive any of those funding sources. Almost all of our funding that we have is through a fee-for-service contract environment. So the things that I'll explain that we do, almost all the things that we do, the programs we enroll people in, and the appointments we schedule, those are all based on different kinds of contracts that we have identified and secured to be able to do those activities. And I like to explain that because when we have ideas of other things we can schedule appointments for or in different ways we can enroll people into programs, we do need to identify opportunities to fund those services because we don't have any dedicated funding to our organization except through specific contracts. And I will add that the County of San Diego is our primary funder for our information and referral services. And then we're also an umbrella organization. This is just giving you a little insight into some of the innovation kind of work that we do, but we did recently acquire the San Diego Health Connect, which is the San Diego Region's Health Information Exchange, or HIE. So that is underneath 211 San Diego, so our board of directors and our C-suite staff oversee San Diego Health Connect as well. So the most important part of today's conversation is how do you use 211? So you can call 211 24 hours a day, and our staff are professionally trained to help people find different services. We have a database of free or low-cost trusted community resources. It's vetted. We vet every single service that goes into our database, so it's not going to be filled with random services that somebody might find on a Google search or something like that. They're vetted and safe. We know that we can connect people to them. And so our staff are trained to be able to navigate that database, which can be quite complex. So for example, a service listed in our database may have a lot of information about eligibility requirements or areas that are served by that service. Our staff are trained to be able to navigate that and kind of help a person understand that. But our database is available online for a public search. So anyone can use our database online, but navigating it, we do often encourage people to call 211 because you might have an easier time finding the service that works best for an individual. And so as you're out there talking to people about what you learned today, letting them know to call 211 is the best place to start. And they can call anytime and in any language. So we answer calls in English and Spanish, but we also use teleinterpreters for any other language, and that's no cost to the client calling. So information and referral services. This is our bread and butter. When we provide information or referrals to different resources, we do it in a very traditional way, which is we tell a person, you can write this down, and we get them the information over the phone. We can also text them or email them all the information about that service so that they have it at their fingertips. And that information that I'm talking about is really listed here if you want to take a look. But it's the different name of the provider, their service name and description, when they need to go there, what are the best ways to contact them, the intake procedure, what kinds of documents are they going to need on hand. All of that information is provided as a referral to an individual. And I want to make sure I emphasize that the connections we make, these referrals, they're only going to be made to resources that are listed in our database. And there may be resources in the community that are not listed in our database by their own intention. So if a resource isn't in our database, we can't refer to it. But we do encourage you to make sure that any partners in the community that are providing a service are listed in our database, because that's how we'll be able to connect people to their services. So we also do a different kind of referral. So what I mentioned before are the traditional, I'll go back one slide. Those are the traditional ways that any type of 211 information referral provider will give a referral out. Text, email, write it down. But in recent years, we've been doing a few other things, and this is the second half of our mission, the transforming how people are accessing care. So we can do what's called a direct referral. So to put it in a bigger context, we have about 6,000 different services in our database that we can refer an individual to at any given day through a traditional referral. But there are about 350 of those services that we have actually built out in a partnership with an organization where we can send an electronic referral to a person at that provider that works at that provider. And it's basically electronic communication that goes to them, and that provider follows up with the client. So what that looks like is if somebody calls us and they want that, and they qualify or are likely eligible for a service that is one of these 350 referrals, we will say, you can expect a phone call within the next 2 business days from Father Joe's. They will call you back. And then the client hangs up. They don't have to do anything else. They will get that outreach from the provider, and the provider will actually enter into our system what happened. So they're closing the loop. And across the US, you'll see that these are becoming more and more the kind of referrals that are being used across systems. They're called closed loop referrals, and they're allowing us to capture the data about that referral. Otherwise, we don't often know what happens after the referral. Are there any questions so far? So that's the direct referral, and that's a special type of relationship we've been building with. We have about 142 community providers across the San Diego region that are participating in a system that allows for that. And then we can also schedule appointments. And we can schedule appointments for our own enrollment assistance that we also offer. And again, these are the types of services that we are contracted to provide. And so I'll explain some of those here, just so that you get a sense of some of the work that we can do. So if you're in the community or if you're working with an organization or individuals that may benefit from these services, these are special services we can offer when they call 211. We can connect people to CalFresh. We can enroll people in CalFresh too, so we'll schedule an appointment with us or with one of our community partners. And sometimes if they're applying for CalFresh, we can do a joint application for Medi-Cal. We can do Medi-Cal enrollment for people that are aged 50 and over. Again, these are just contract restrictions, which is why you see some of those limitations. And then we also can provide appointments for free tax preparation services. There's a coalition in San Diego called the Earned Income Tax Coalition, or Earned Income Tax Credit Coalition, EITC. And that coalition of 20 or so providers provides free tax preparation assistance to people with qualifying incomes. And we work with them and we schedule appointments for their free services. And the benefit of using those providers is that an individual that goes to those providers is going to get special assistance, making sure that they're checking the boxes and all of those tax credits that they may be eligible for, including the Earned Income Tax Credit at the federal level, the state one that's also offered, and then child tax credits and other things that they have qualified for. And so we can schedule those. We usually do those between January and April, but sometimes into June if it's extended. And we do about 10,000 of those appointments a year. It's a very sought after community service. And then we also can connect people to a variety of utility discounts and different kinds of assistance, and that includes medical baseline, which is especially important, and I'll just point that one out because during any type of emergency or any kind of public safety power shutoff that might turn off the power, if you're enrolled in medical baseline because you have some type of device in your home that you need for medical reasons, for life, to remain alive, then you're on a list that will be given some extra hand-holding when there's type of power shutoff. So if you do have a device in your home, getting that registration and your utility discount through Medical Baseline, which is a program offered, then you're in a better position in the community should there be any type of threat to your neighborhood. So that's just like one example of the different kinds of utility programs we can connect people to, but I wanted to give a special highlight to that one. And also CARE, which is the utility discount. So if somebody has an eligible income for the CARE program, which is California Alternate Rates for Energy, you can get a range of a discount up to, I think, 25%, some people 35% on their utility bills. And then we also have a special contract program for tobacco cessation where people can call and get enrolled into some programs for quitting smoking. And again, these are just different contracts that we have in place. So we are very open. If you ever know of any programs that we can be a partner on, please do reach out and let us know. And I want to highlight our disaster response because I know that Santee has dealt with fires. And we recently actually just responded, I know it's not in the Santee region, but the Los Coches fire. So we just did some response to that, and I'll be happy to explain some of that. But we partner with the County of San Diego to provide official non-emergency information during a disaster or a public health emergency. So what that looks like is the county might activate us. And if they activate us, they will start sharing information with our organization. And it's often through Alert San Diego as well, if you've heard of alertsandiego.org or .gov. I don't know the dot. But if you, the county will then push that information to our organization, and we will be a place to call. So people can call 211. And the reason why that's important is because during the 2003 wildfires, which we all are very familiar with, the 911 system got overloaded. And then when 211 came into being in 2005, we got the county immediately signed a contract with us for this type of disaster response service. So in the 2007 wildfires, we were able to take 450,000 calls. So that offset those calls to 911. And those calls are generally for information, not anything emergency. It's information about the evacuation zones or shelters or food or just questions. And that really helps to offset the calls to 911. So we get calls during a disaster. We also analyze that data. We document questions that people are having, and we share that back with the Office of Emergency Services or the Department of Public Health, whichever arm of the county's activated us. And then we continue to get updates and questions answered and share that back out to the community. This is just an example, a list of the different kinds of responses that we've had. I've been a part of almost all of them except the 07 because I came in 08 or 09, one of those. I left and came back. But the most recent one is the Los Coches fire. And we weren't necessarily activated for all of these, but we did play a role. And you'll see some of these aren't even local. So there are 211s across the U.S., and if one of our 211 partners goes down because of the utility going down or the power's out or they're all impacted and they can't respond, such as during some of the hurricanes, they activate another 211 somewhere else, flip a switch, and we can answer the calls coming into their region. And so we have a very strong redundancy plan across the U.S., so should anything happen locally, if to our own 211, our partners would be able to answer those calls. And we have a number of different public safety partners. And I've talked about the county. We have a partnership with CAL FIRE, so sometimes they may need to push out the 211 number for a fire. And then SDG&E, we have a partnership for public safety power shutoffs. So if they do have a PSPS event, public safety power shutoff, where they're going to shut off the power in a neighborhood because of high winds or other type of fire threat, we get activated and they will notify that community that if they need help getting out of that community or getting to a local assistance center that they're setting up or getting to a motel or getting a voucher for a motel, that they will call 211. And so that's part of our partnership. And we also have a partnership for that contract to make sure that people with access and functional needs, especially people that are living alone and especially in an unincorporated region, that they are well prepared for a PSPS event. So what that might look like is we might call an individual who might be on medical baseline, and we might, or anybody with access and functional needs that interrupt their daily living activities. And we would then encourage them to build a plan. We might build it with them, and we might also tell them to get the contact information for the hospital that provides oxygen to them so that in the event of a PSPS, they make that phone call and they get their backup tanks and things like that. So we work with them in advance to ensure they're safe during a PSPS. And then we also have a new partnership with Airbnb.org, and this is what we were able to activate for the Los Coches fire and also the recent Kearney Mesa plane crash, where we were able to work with Airbnb directly, get Airbnb credits, and provide them to people that were impacted in their homes and unable to stay in their home, and we were able to get them into a safe house. So the people that were affected by the Los Coches fire, we've gotten, I think, four of those households were qualified for Airbnb.org support and had been staying there for a month. We got another extension, so 2 months. And then two of the families are going to get a 3rd-month extension to just make sure that they have a place to stay while things are sorted out for them. So that's a special partnership we have that we're bringing to the community just this year. It's brand new. And 211, they're partnering with 211s across the U.S. for that. And lastly, I want to make sure that you know the 211 community calendar. So I talked about the services we can connect people to, but we also have a calendar. So we also vet all of these as well, but these are more one-time events or recurring special events and may not have eligibility attached to it. So if you go to our website or 211sandiego.org/events, or just click events on our webpage, you would be able to search the different events that different organizations and cities have chosen to list in our community calendar. You can search by city, you can search by neighborhood or by keyword, things like that. And I want to encourage you to share that, especially in the community as you're trying to connect people closer to the community so that people can access things that they need. And I will add, some of this is educational, like seminars, especially I would say the Alzheimer's Association posts all of their events into this calendar. We have a lot of different education pieces happening, but also a lot of resource fairs or family-friendly events that you can explore. So I'll bring it to the end of what can you do. So the best thing I think you can do is just tell people that 211 is available. We are a free community resource. We are your community resource. And we have a number of flyers, and I have different wallet cards I can leave with you just to give you an example. But I also wanted to make sure you know we have a reentry pathways flyer in English and Spanish that you're welcome to use however you would like, and also general 211 flyers as well. But we have little cards you can keep in offices where people might come that might benefit from learning about 211. And so those are just some of the things that I wanted to offer here today. Happy to take any questions.
Great. Quick question, as it's been a while since I went to the site. It says John O'Hannon's still the CEO. Is he still the CEO down there?
He is not. He left in 2020. I'll have to find out what website you're on.
Well, 211.
Oh, is it 211.org?
Yeah.
That's our national one. That's the 211 at the national level, and it sounds like they haven't kept up to pace on that, so I'm going to reach out to them after this. Thank you for letting me know.
Yeah, I was going to say, they came back or what?
No. Yeah, he works he still communicates with our current CEO, Bill York.
Okay.
Yeah.
Great. Well, I remember John, and when he got this whole thing started way back, 2005, somewhere in there?
It started in 2004 as our own nonprofit, launched in 2005.
Right.
Yeah.
So, matter of fact, They used to have cities that became members. Do you
Yes.
still do that? And are we still a member of that, do you know?
We did have I think the city of Santee at one point was a CIE member, so I didn't go into that today, but because it can be quite complex. But we have, when I mentioned the electronic referrals that we can share with 142 organizations, those 142 organizations are community information exchange partners, and they are participating in a shared ecosystem where they can access a client's record and provide a service to them, and we are able to update that client's record together over time. The city of Santee, I think, was a original CIE partner, but we have, I believe, there's a fee associated with it, so we can always talk.
Yeah, there was back
Further.
then, too.
Oh, okay. So
Yeah.
we can talk further about it, because I think we would absolutely love to have the city of Santee be a CIE partner. I will add that the Santee Unified School District is a CIE partner. And so we're trying to help school districts get involved so that when the nurses or school counselors or social workers are connecting people to services, they can take advantage of the ecosystem that we've built. But-
The reason why I asked that question is because, well, quite frankly, we haven't talked about it in a long time. However, I think it would be very helpful for our homeless working group committee. And yeah, I know something was going through your head probably as this was being discussed.
The marbles came loose. What'd you hear?
Well, I was thinking, well, probably the same thing I was, is how do we, like, for instance, let's say a deputy is out there and something just isn't quite lining up. And a 211 call by that deputy may be that stopgap, so to speak. Because I know you guys are aware of 211, probably do with stuff with that all the time. But that just, sometimes we don't think about that as one of the first things or one thing that we might go to when we're kind of scratching our head, running out of ideas. So that might be something that we could do. And that goes for a whole lot of other things besides our homeless group.
Yeah.
So maybe we should, maybe have Nick get hold of you and
We
maybe
also-
talk a little bit more about that.
We'd be happy to come out or invite anybody to our office for a tour and connection, or we can come out here. I think my CEO would be happy to participate in any conversations.
Who's the CEO right now?
Bill York, and
Bill, okay.
yeah, he's been there
around a long time, too.
Yeah, he came as a volunteer during the 07 fires and never left.
It's like an abyss. Okay. Anybody else with questions or comments?
I'm curious, without going into a lot of detail, is there a vetting process of some sort when you're looking at potential service providers that you would incorporate into the network? What, just at a high level, what kind of, is there a vetting procedure, and what might that look like?
Yes, thank you for that question. Yes, there is a procedure. We have what we call inclusion criteria, and that criteria is approved at the national level from, it's called Inform USA, and it's kind of the highest accreditation a 211 provider can get for being information and referral certified. So we use criteria that's nationally approved to make sure that organizations we're adding to our database are legitimate and kind of meet certain criteria so that they're useful for clients that are calling and dependable. So, for example, one of the criteria is you have to have been around for longer than a year in service. So it's not a brand new service we're connecting somebody to, or you have to be a nonprofit or government service or a low-cost other service, such as a healthcare service, or free or low cost. So those are just some examples. And if they aren't any of those things, if they are a higher cost, because there are a lot of, I would say for older adults, there's a lot of high cost things, but that's also filling in a niche kind of level of service that might not be available otherwise. So then we would have an exception in place to allow some of those. But that's just to give you an example of how we will vet those.
Steve?
Yeah, thank you very much, Jessica. That was a very informative presentation. You mentioned during the disaster response section that 211 gets involved if they're activated by the county. What does that mean, and is it in concert with 911 or completely separate?
So it is separate from the 911 work, but it is, so when the county activates us, I'll go back here. We have a contract with the county for disaster preparedness. So we are technically always watching what's happening in the disaster world, and we have a duty officer that the county will contact just to keep informed of evolving situations, whether or not we're activated. And so we get that information, and we're constantly on alert. And so if somebody were to call us about something that we haven't been activated for, we would very likely have all of that information because we're watching as part of our preparedness efforts. But when the county decides that there is an event that requires some type of incident command structure, then they will activate us at a level 1, 2, or 3. And if it gets, I think 3 is the lowest. I can't recall. But if they reach out, that just means we have a person dedicated to kind of watching and the resources and plugging them in. If we get activated at a level 2 or 3, then I believe we switch into our own incident command structure. So our priority then becomes the disaster, and we have people designated to be different roles that any type of incident command structure would have. And we might send, if it's a level 1, we would actually send one of our staff to the Joint Information Center. The county calls it the JIC, where all of the different command posts are located and communicating in a single room at the Office of Emergency Services. And then we would be getting much more detailed information directly from them and being able to share that with our staff. And then special questions could also be relayed back and forth. But at a level 3, or mostly a level 3, we would just be kind of watching, but we would be doing things. So the activation is really, if we're activated, it's more for our payment. So we would be in a position to track all of our costs. Whereas if not activated, we're still just doing our work, but we have a special contract for when we are activated that allows us to get reimbursed if the county is given FEMA money or other avenues that I might not be fully familiar with.
Got it. And so I think you mentioned something about, I forget which disaster, fielding 400,000 calls or some enormous amount. Were those calls directly to 211 that people were knowledgeable about 211 and reached out to get information?
Yes. So in 2007 wildfires, that was before my time, but I'm familiar with the history. That was the first time that the county activated us, and they pushed out the 211 dialing code for the community to call. And so just them pushing it out at all the press conferences, and I think it was pre-social media, but all the different avenues that they had to kind of get that out, that's what drove the people to call us. Media pushed it a lot during a disaster. And we didn't answer all those calls ourselves. We actually had a volunteer force of about 1,200 people that came from the community, that got trained, that participated in our call center. We actually hadn't quite even built up at the time, so Qualcomm donated a bunch of computers and phones, and we kind of got all situated at the time. But it really helped put us on the map. But then after that, we made sure that we had all of the capability in order to be able to expand our phone center should another disaster happen, because we get about 300,000 calls to 211 in a given year. That doesn't include all of our other hotlines we answer that I didn't talk about today. But we have the capability to answer hundreds and hundreds and hundreds of thousands of calls. And so now, I'm going a little bit outside of the lines of your question, but I think it's useful that the county has disaster service workers that they've set aside that can be pre-trained and activated. So if the county activates us, they may also, at our request, activate their disaster service worker corps, who are all in a call center trained, and they can jump over to our hotline and answer calls without the need for a volunteer force. If it gets worse than that, then we'll have a volunteer force come on as well.
Great, thank you. And one other question. I think you mentioned at the very beginning that only certain resources are in your database, and I thought you mentioned sometimes that's by design of the resource, from the resource side, that they don't want to be in the database. What would be a reason that a resource would not partner with you?
I think some organizations have expressed that they have such limited resources that they would be having to turn clients away if they got, I mean, think and one of the top referrals and needs, but the fewest resources available is rental assistance. So if somebody is offering that to a specific, region, sometimes they may not want to have it listed because the money's going to be gone very quickly. And so it all depends on their perspective. I would say that more often than not, an organization is willing and wants to list their service. I just always use that as kind of a default, just so you know. But we do often get referrals from partners that might say, this organization doesn't list their service. And really, it's just a barrier of us letting them know how to list it. And I would say more often than not, organizations are very willing to do that. So I want to make sure I leave on that note. But it's usually just a little bit of a concern on their end about resources.
Thank you.
Yeah.
So just to kind of give a little more background on the way this all started, is we had the Creek Fire in 2003, and it completely shut down the county's operations and ability to communicate because there were so many calls. And 211 was kind of a fledgling idea out there at the time. And so after the 2003 fire, that's when 04 came along, 05, and they really started working. They started building some infrastructure. And so when 2007 came and everything was in place, but it wasn't big enough because people weren't thinking about a disaster of that magnitude, because we can handle small, disasters pretty much easily. And I remember so clearly the discussion about Qualcomm and getting all of the phone lines, getting the phones, getting the computers and everything. And it really was almost a lot or too little too late. But what it did is it was an extremely valuable learning lesson for everybody, not just in our community, because we hadn't really had any big fires like that in a, closer to an urban setting. Before that, wildland fires have been going on for years, but you don't have that many people living that far out where there are those kind of wildland fires. So, because I remember, like I said, working with John and talking about this and having meetings and being kind of on the ground floor, and it was actually quite fun actually to be involved in that. And so today, and also to answer some of the question about first thing that happens is when there's level 2, first thing you start hearing is information in the news about if you have any questions, call 211, because the county's disaster system cannot handle all those calls. And then when we go to level 1, then you bring all the volunteers in and everything, and that's when it really gets rocking and rolling.
Yeah.
And it could last actually for several days. So they kind of just a little bit of extra information on what you had. And the only reason why I know is because I was there for all of that and whatnot. Does that also enhance the answer a little bit?
Yeah, thank you.
Okay, you're welcome. Did you have something?
I think a discussion about the CIE, the community,
Information exchange.
is very useful for law enforcement, homeless outreach workers and things like that to have that database. And so maybe that's a conversation that we could have separate from this one. I'm very familiar with 211. I work for the largest substance use disorder provider in San Diego County. Very talented staff, case managers that often call you. I also have one of your former employees who said the most unusual call she ever got, and I'm sure you have a long list, was a woman who needed help because her cat shed too much. She was able to connect her to a free vet clinic
That's great.
So, I mean, when you think of it, at first you're like, really, this is a question, but the resource was there. And so I really encourage people that, think, well, they're who do I call? It probably is you. So very grateful that you're around. I think it would be a great discussion to have, as the mayor suggested, about how the CIE would work in collaborative efforts. But I appreciate the presentation and really appreciate what you do.
Great, thanks. Linda?
I too am grateful for your presentation. I am just curious as to what other disaster relief organizations are aware of your service. For example, the American Red Cross. Do they share that information, or UMCOR, the United Methodist Committee on Relief? Do they share information with individuals? So I'm just curious as to where you might get. You've mentioned frequently the county, but I'm curious about other organizations, particularly relief organizations.
Yes, that's a great question. And we work very closely with the Red Cross. They're actually our neighbor on the same street. And we just saw Sean Mahoney, the CEO, at the town hall for the wildfire town hall in Ramona for Supervisor Anderson on Monday night. So we work very closely with the Red Cross. They were actually the ones that were the boots on the ground getting the names and screening households in the Cochise fire that needed help with Airbnb, and they relayed those to us. So that was a partnership with them and the county and Airbnb.org. So we work very closely with them in general, but then we're also part of VOAD, the volunteer organizations active in disaster, and meet with them monthly. And I think a lot of organizations that are active in disaster, such as the other organization you mentioned, but I'm not familiar with directly, may be participating in that. And if not, maybe they should, because that's kind of where all the community organizations in disaster coalesce. And VOAD, I will add, is a very good partner on the ground as well in a lot of these responses that we...
UMCOR is an extension of VOAD.
Oh, okay, excellent.
All right, anything else? All right, well, thank you so much. I really appreciate it. It's good to kind of reconnect and talk about old times. Hate to say it like that, but
I know.
but the times are very different than what they were way back then, so valuable lessons learned.
Well, thank you, Mayor.
Thanks. By the way, Bill probably remembers me, so
He
tell him I
does.
said hello.
Okay, I will. Thank you.
I didn't know I was that old. Well, you say that because you're just almost as old. All right, then. Item number 5, community core value update. Do we have anything? Linda, have you guys met, or have you heard from David or anybody, or Steve?
No, we did get a communication from Bree, the marketing manager, about some art installations that have highlighted the community values throughout the city, and I was going to respond to her and find out some of those locations and check them out, but I think Linda...
I have actually seen one, so I was delighted beyond measure when I saw it.
You said did like it or didn't?
I was delighted
Oh,
beyond
delighted.
measure
Thank you.
that I saw it, yes.
And those are the ones on the
The
Boxes?
utility
Boxes, yeah.
boxes, right.
yeah. I know there's one in Mission Gorge and Olive, and
That's where I saw it.
yeah, there's several other. I just don't remember. I think there's one at Fanita in Mission Gorge also. Just go by the different intersections and you'll probably see them. They're pretty cool, actually. I like
They
the,
are.
I really
It's
like
nice
the one that
artwork.
has a license plate that says Santee on it. So that's pretty cool. All right. Have you heard anything, James? Anything at all, city manager? Okay. Thank you. And let's go with communication from committee and staff. Let's go committee first. Anything at all, Steve? Danette?
Nothing.
And Linda? Okay, and I don't actually have anything. I do have something. Carl, believe it or not, I've seen some guys out there writing tickets lately. I think we have a guy on a motorcycle right now, and I've seen him out there writing. And
Where?
different intersections.
Oh, okay, well, that's fine.
Yeah, well, it's not often because, and I don't sit around just waiting for them, but I sure could have used one today. It's the only time I wish I still had a ticket book. But I have caught them out there. And I just want anybody that's watching in, I want to tell everybody, please be careful driving around out there because we have a lot of road work going on, and that tends to make things a little bit unsafe. Anybody that's gone by the intersection Mission Gorge and Cuyamaca, should have seen that there is construction going on the southeast corner. That's going to be a right turn pocket that's put in there. And I think they're doing a really good job because they're doing a lot of the work that has to be done prior to taking out the sidewalk and the curb, so that makes it a lot safer. So I look forward to that, coming finished. Yeah, finally it's happening. So that's about all I have. Anything, James? Anything, committee? Okay. All right, then. That's going to take us on to public comments. You have anything for us, Carl? Okay.